Hi everyone. I'm absolutely delighted today to be joined with Dr. Marcus de Brun and Dr. Billy Ralph, who have recently gone through some Irish Medical Council hearings. I've actually attended both hearings at different stages, and I have to say they were very, very thorough and very in-depth. And I just thought it would be beneficial to bring both of the doctors on to have a brief chat about those hearings, about their experiences during those hearings, and whatever outcomes that we have at this current moment in time. So I suppose if it's all right, we'll start with yourself, Dr. Marcus de Brun. You might give us a little background as to why you were brought in to the Irish Medical Council in the first place, what you experienced while you were there, and what next.
Oh, well, I think probably, and a lot of people watching or listening will know a little bit about why I was brought to the Medical Council. I don't mean to laugh, but it is kind of funny. I suppose the complaints, I mean, the Medical Council initiates investigations and sanctions upon doctors and hearings and strikes them off if there's a complaint. And, in 2022, I went to a public gathering at the Customs House to object to masks and to make some complaints about what was happening in the nursing homes, because so many people were dying there because of the policies and that. But anyway, there was a complaint issued to the Medical Council that someone observed me shaking hands with people and they didn't use hand sanitizer. And then there was another complaint about social media posts or something. So the complaints were fairly frivolous. The purpose of it really was to make sure, send a message to the rest of the doctors in the Irish medical establishment that any sort of complaining about vaccines, COVID vaccines in particular, vaccines, masks, public health policies, lockdowns wasn't going to be tolerated. So one of our colleagues, Jerry Waters, had already been suspended for refusing to refer people for PCR testing. So essentially the Medical Council was rounding the wagons and preventing anybody from speaking out. So we got these complaints against us. That's kind of the background of mine. And that was back in 2021, 2022, the investigations kicked off, and they went on for 5 years, and then the hearings have just kind of kicked off this year, and so we had 3-4 days of kind of fairly grueling hearings back in September of last year, October of last year, and then another 3 or 4 days of them in June, May, June, and they've concluded anyway. I've been found guilty of undermining public health guidelines, and I'm awaiting my punishment, whatever the punishment is going to be for that. And of course, it was a kind of a moot point because I was entirely guilty of undermining public health guidelines and would undermine those guidelines again. So the real kind of objective of the council was just to find us guilty about something, find me guilty.
Yeah.
Because to say that the guidelines themselves were wrong or what was done was wrong would have massive political consequences and consequences for the medical profession. So essentially, I undermined the guidelines and was found guilty of doing that, of undermining the guidelines, and now I'm awaiting my punishment, whatever form that's going to take. The Medical Council is deliberating on that at the moment. So that's where I'm at.
It doesn't. So regardless as to whether or not those guidelines were the correct or the right thing to do at the time for your patients, that's irrelevant. They don't care about whether the guidelines were right or correct, which a lot of us would agree. Looking back now, they weren't the right thing for a lot of people, but that's irrelevant. They don't care about that. It's purely your messaging at that time. Is that correct?
Yeah, well, the messaging, I suppose, I mean, when we say guidelines, we to be kind of a little bit specific what we're talking about, so, the lockdowns, the masks, the COVID vaccines, the suspension of civil liberties, all of those things, they were guidelines. And the vast majority of them have since been proven to be completely wrong and misplaced, and certainly given the COVID vaccine to young children and to pregnant women, which was that caused my fallout with the Medical Council. That's been proven to be to have been true as well. But the consequences are just so huge that the Medical Council is not in a position to take ownership of any of those consequences. consequences or any of those guidelines. So yes, they're simply just pushing the narrative or pushing the objective that one undermine those guidelines, which is really strange because as a physician in Ireland, and this is kind of where it starts to get a little bit surreal. There was 7-8 doctors in Ireland who were put into this category of publicly criticizing the guidelines. But the bizarre thing is that doctors should be able to criticize guidelines, and doctors should be able to not give a vaccine or not give a drug if they feel themselves that it's dangerous or that it's not harmful. So these rules that the council are imposing are almost like a weird and a brand new interpretation of guidelines. So, and the surreal or strange thing is that so few of our colleagues seem to be willing to protect their own right to question guidelines or to protect their own right not to have to give a drug or a medication if they feel against it. I mean, and if you put that in the context of something like abortion, now regardless, I'm not getting into any pros and cons, pro-life, anything. I'm just simply saying that doctors have a right, if they conscientiously object to performing abortions, they have a right to do that. And that should always be in place, that right for a doctor not to have to do something against his or her conscience. But very strangely, during these guidelines, as far as government is concerned now, doctors have to give COVID vaccines or have to give these things. I mean, you can't simply refer them on. I mean, in the case of abortion, for example, if a woman comes for a doctor who doesn't agree with abortion, the rules are fairly simple. He or she is supposed to refer them on to another doctor who will do that. And of course, all of us who objected against COVID vaccines would follow that, and we would have no problem referring the patient on to another doctor who would give the COVID vaccines. But all of these kind of rules were thrown out the window and reinterpreted. So, and it's not just, I suppose, the protection of patients, but the profession itself, because it seems, given up. Doctors have given up through these proceedings, at least in the context of COVID, have given up the right to either question or to administer drugs or things. If the government tells you to do something, you really have to do it. That's what these hearings are saying, regardless of your conscience,
And for as a lay person looking on, I have to say that it was to me, it was terrifying to see the doctor-patient relationship being interfered with by government and by government rules and regulation. That was just, for me, again, it was just one of those things that just felt completely wrong. It was completely wrong, but so over to yourself, Dr. Ralph.
It's ongoing, that government involvement in the patient relationship, and we're back to. We haven't moved away from guidelines. I mean, the entire chronic disease management program that GPs earn a lot of money out of is driven by guidelines. Now, there is an assumption that these guidelines sit in this heavenly space of pure science, where the evidence has been nobly gathered by these people without vested interests. And all the guidelines are there to protect the patient and improve their health, etc., and all the other hypocrisy that goes along with modern medicine. They're the same as the COVID guidelines. There are vested interests behind them. There is, and you should always ask this question when there are guidelines or directions or whatever, is that notion of cui bono, or bono, not bono, the name gives me shivers. Cui bono. So, and then when you say, well, who benefits? Well, if you start drilling down into, I mean, even for instance, on a day-to-day basis, and Mark's will come across this as well. Patients with a cholesterol above a certain level are supposed to get a statin. Now, I know you're supposed to do a kind of a risk analysis, but in general, most of them get statins. That's why it's a $19 billion a year worldwide industry to prescribe one class of drugs. But to not prescribe a statin requires you to step outside the guidelines and spend a lot of time with the patient. And you'd be very much discouraged from doing that because you're made to believe, you're putting that patient at much higher risk of cardiovascular disease, et cetera, And then later on, when you're giving them the statin and they come in with all the aches and pains, etc., well, lo and behold, what do you give them? You give them another pharmaceutical product, or you switch them over, but you switch them over to another statin. So you kind of, as soon as you step into this medical paradigm of guidelines, and you don't say to yourself, well, hang on a minute, there's a world that exists, and there are intellectual realms that exist outside of these medical guidelines. The assumption is that there's this hierarchy of knowledge and science intermingled with medicine. We're at the pinnacle, and everything below that is substandard knowledge. And therefore, if a patient comes in and says, oh, I think I was sleeping with my feet to the window, and I got a chill. And you go, I know better than you do, you silly person. You didn't get it from that, but we immediately have this superior attitude to our patients, and that's what happens. That happens with all these guidelines. We suddenly apply them. Not only do we apply them, as we saw in COVID, we ram them down society's throats, regardless of the actual outcomes, because we're doing it for their good.
Wow.
And as soon as you hear that, it's for your good, you should run a mile in the other direction, because if a state says to you, it's for your good, it's not. You say, qui bono, and it's not benefiting me. Who is it benefiting? Where's the money? Where's the power structure? And that's where all these guidelines are. They're little fluffy areas of knowledge. And don't get me wrong, I mean, there are benefits, but they're not the benefits that they state there are. And there are too many vested interests and too much money and too much power intermingled with these, and intermingled with the whole notion of getting people to go along with these guidelines. So as doctors, or as somebody who has a frontal lobe, you don't have to be a doctor, just a frontal lobe that functions beyond 2 cells, you should say, well, hang on a minute. Tell me how this works. I don't want to know. I don't want you to tell me it works. I want you to tell me, how does it work? Where did you come up with this idea? Has it worked before? And what are the downsides? Nobody asked that. Well, we as a group asked that, but nobody asked that during the COVID. They just went, oh, yes, big scary Tyrannosaurus Rex is going to come and eat us. Michael Martin said so. So let's all run over this direction. What's in that direction? Don't ask, just run in that direction.
I think as well, though, Dr. Ralph, there was an element of people were tired. There was exhaustion over the lockdowns and the measures and the restrictions and all of that. And people saw it as a way out.
That was deliberate, Elaine.
Of course. Of course.
That was to generate the state of mental exhaustion. And it was like, I mean, the Sage in the UK was their equivalent of our NEFIT. They employed nudge psychology. They had more psychologists than they had epidemiologists, and we didn't know any epidemiologists on NEFIT. So they used nudge psychology. So you want somebody to step into a cage with a tiger. You can't say, I'd like to step into this cage with a tiger. Any sane person going, I'm not going in there. But you bring them over here, and it's nice, and you get a little reward. You bring them over there, and it might be a little bit of pain, but they get a reward. And eventually, they find themselves sitting beside the tiger. And they're hoping that that's a fully fed tiger, because if it's not, you're gone. But that's what the whole lockdowns and the masks and the taking kids out of school.
It was a form of torture. It was a form of
it was nudge psychology.
Yeah.
It was it was absolutely. It was one of the. It's the wrong thing to say, but I don't know what other way to put it. But one of the funny things or funny points during the process, I suppose you can find some of this funny now as looking back, was Luke O'Neill's, when he came out first and he was doing, remember he was on the telly and he was saying, oh, masks are useless and they're totally pointless. Shouldn't wear a mask. And then all of a sudden he did this kind of weird turn. There was a 180-degree turn, a volte-face, and it was, oh, masks are absolutely essential. You have to be wearing masks.
Yeah.
And, the thing that was lost in there, what people didn't realize in there, is that the power that putting people into masks, once they put people into masks, well, that was the deal sealer. That sealed the deal for the vaccine, because once you got them into masks, the only way to get them out of masks was with the vaccine. So O'Neill, who's managing director of his own pharmaceutical company. This pharma boss was dictating, or at least encouraging, the masses to get into the masks. And of course, he was the darling of the media everywhere. Everybody wanted to talk to him. But he was encouraging people. First of all, he was speaking a bit of science, saying, yeah, these things are not going to work for this environment. He was speaking a little bit of truth, but his wings were clipped and he was pulled in and reined in very, very quickly, because certainly in order to get the vaccine, it was orchestrated, I think, in a very constructed and organized way. But certainly the masks were absolutely essential. The only thing that the masks did with any effect at all was to encourage people to take the vaccine, because, as you said,
100%.
people were scared, people were frightened. And once you put this mask on their face and they're walking around society with this mask, psychologically you're willing to do anything to get out of
Well,
it, you know?
it was also a silencing. Your mouth is covered, your nose is covered. There was a gagging kind of a intention behind it. In my opinion, it was to further stop socialization and further stop communication between people, which was vital for them to keep pushing what they were doing. But
Oh, it was. And just once I brought up the subject to Luke O'Neill, I was just telling Billy earlier today, I had a patient came in to me yesterday, a chap who was an inmate in Mountjoy prison during the COVID. Now, a very nice man now. He's turned his life around. He's getting married. He has a couple of kids and all, and he's a partner and everything. But he was going through a rough patch, and he ended up in prison, and he was in Mountjoy. And I met him for the first time yesterday as a patient, as such, and I said to him, why did you come to me? He doesn't live terribly close. And he said, because I saw you during the COVID and I saw what you were saying during the COVID. And he says, can I tell you something about what went on in Mountjoy? He says, you're probably not going to believe me. Now, the chap seemed perfectly reasonable to me, but he said, Luke O'Neill came into Mountjoy prison and gave talks. This was before the vaccine. He gave talks encouraging the inmates to take the vaccine and get the vaccine. And then he said to me, and you're really not going to believe this. And I said, what? I said, I'm not surprised O'Neill was in. He says, yeah, but he says, it was almost like they were practicing on us, on the inmates, giving us, because Luke O'Neill was apparently telling them about all the viruses that were out there, and there were waves that were going to be coming, and the new viruses that were coming, and the only way to save themselves was with vaccines. And I said, yeah, well, look, he was touting all that horse shite throughout the bloody thing. So he says, this guy was saying, yeah, but he started it with us. We were the guinea pigs. And he said, and you're not going to believe this. He says, if you agreed to take a COVID vaccine, they would reduce your sentence. And yeah, I said, okay, well, look, that's not, he says, no, he says, I'm telling you the truth. He said, I refused and I didn't want to take the vaccine, so I had to do out my sentence. But I was just listening to him. Now, whether it's true or not, I'm definitely going to organise an FOI to be sent into Mountjoy and try and get some information.
That needs to be done ASAP for sure.
But when you think of the parallels, though, the whole notion that inmates, because that's the way he put it. He said, nobody cares about people in prison. We were the first that they kind of tried it on, and they tried to kind of brainwash people, and that they tried these techniques out on people. And I just thought to myself, all the lows in my mind, as far as medicine and the establishment and politics, all the real lows, the dirty stuff where corporations are controlling politicians, and where it's a money agenda driving health. All of those lows were certainly hit. But yesterday, when this ex-prisoner came out with that information, I just said to myself, there are no low. There is no bottom to this. There's no bottom to how dirty.
There was no ends. There was no ends to which they were going to go to. And before we move, I want to talk about Dr. Fauci recently. But before we do, just one of the things that stuck out in my mind during late 21, was they had tried everything. They'd pushed all of the tricks, tried out every trick of the trade on the old, the middle-aged, the young, teenagers. And I remember one of my daughters started college in September of that year, and she rang me extremely upset because they had opened up a mobile vaccination unit on her campus that day, and it was a queue a mile long because they had also opened up the nightclubs the same night. So this is the this what they were doing to people was showing them what you can have here, but this is all you have to do to get it. And that, to me, was the worst form of manipulation on a whole generation of teenagers whose parents had probably protected them for the previous year, thinking, don't get it, hang on, wait and see. And then the first bit of freedom they got, a whole cohort of them went and took the vaccine because they felt they had a bit of freedom coming. Anyway,
This whole thing,
go ahead.
Just one second. This whole thing is like pharma profits are enmeshed in this whole thing. I mean, if people want to look up Stefan Bancel, who was the CEO, or probably he's still the CEO of Moderna, and look who he worked for before. And that was a few years before Moderna, but he worked for the company that built the Wuhan lab. So how much of that coincidence is that? I think it's in Robert Kennedy's book, but you can certainly find it in numerous other books about COVID. But I mean, and Moderna had never really produced a product up to the COVID vaccine. And then they have massive investment by one of the world's richest men, who then turns over this fantastic return on his investment, boasting about it on American TV. That is like, this is the man who set up Microsoft. This was his best investment ever. I mean, Jesus, how much money did he make out of this? So you can see, without going down too many rabbit holes, there were a few lads who probably got together and thought, the population, and you just have to speak to patients, and you can see how they frame health. People frame health as though it's an absence of a pharmaceutical product. So they're expecting when they come to a doctor that they're going to have their health returned from the end of his pen. He's going to write, and health is going to appear at the end of the pen by whatever they take. And then they're awfully disappointed if, and not all of them, a lot, if you spend time with people, they're not. But if you try to rush it, then and because general practice is rushed, what comes out at the end of the pen is seen to be the solution of the most complex socio-emotional and biological issues that come into your room. But a product from a pharmaceutical company is the ideal solution. But I think the pharmaceutical companies are well aware that that's now embedded, even without direct-to-patient advertising, because you can only do that in America and New Zealand. The rest of it is all about these special interest groups and people who have, the absence of a SSRI in their life syndrome, all that kind of stuff, that's embedded in society. So if you want to get your product out there, all you need to do is create the concept that we have a deficit for X, Y, and Z. Now, how you do that, you leave it up to you. You can create a war to do that, whatever, or a pandemic, whatever you want to do. But you create the notion that there is a deficit for our product. And then people will just take it. They'll just take it in droves. And that's exactly what we had. So I'm nearly convinced that you have these small groups of very, very influential people have been creating a mindset in society as vehicles for their products. And they influence, most of postgraduate medical education is funded by the pharmaceutical companies. You don't get a lot of GP courses on nutrition and metabolism. Metabolism is such a complex subject. If you look at Professor Ben Bickman, right? He's an American guy from I guess the Brigham Young University. He's a cellular biologist, right? Just on kind of metabolism and cellular biology related to how humans work. He has 150 lectures on YouTube, and they're all about 20 to 30 minutes. I can't recall an hour of nutrition and metabolic stuff in university. And now that I've been practicing for years, I see that actually they're the fundamentals to health. Both taking the time to understand and deliver them to patients, and not rowing in with this concept of it'll come out at the end of my pen and you'll be okay and I'll get out of my room, that kind of thing. But the pharmaceutical industry know this, and they have various campaigns to deliver various products. And if it's a massive, massive product, like $100 billion or whatever it is for that COVID shot, you can be damn sure that they had a lot of spitballing and a lot of, brain draining and whatever else you do, brain bashing, in order to come up with a big program. And of course, then what you have is you've got these really, really influential industries I mean, if you look at like 50% of the Irish GDP is made up of 10% of large corporations, and 40% of our exports are pharmaceuticals. So, do they have an input into lobbying our dopey politicians? 100%, and they're much smarter. They're infinitely smarter than what we've got in the Dáil, and they just apply that influence, and they don't apply it over one government term. They're in it for the long haul.
Yeah.
Pfizer have been here since the early 60s. You know, they understand Irish politics. They understand the corruption. They understand the civil service system. They know how to roll that out. And then they have these models for all Western democracies. I mean, I suppose when we looked at the common response to COVID, there was this remarkable similarity. The yellow and black tape, the same statements, the same drawny faces, the same types of speeches, etc., and the exact same approach. Now, we thought, oh, well, of course, they just got together through the WHO and they decided on this. Well, no, I would say the common factor is big pharma in all of those countries, with their massive political and lobbying and influence. And I'd say they set the seeds for all of that before this occurred.
Mm-hmm.
I thought Marcus could talk, but now I've been talking there for forever.
You're taking over. You're winning. You're winning, Dr. Ralph.
Thanks. I think I have time to.
One of the most hypocritical things I've witnessed in the last couple of weeks in particular was watching Dr. Fauci being brought up, and he pleaded the fifth over 100 times in his hearing or his trial, and and I rang you, Dr. De Brun, about this because I was quite upset, and I just thought, what is wrong in Ireland when we have the Americans bringing the decision makers up before a hearing to challenge them, to question him, to ask him, why did you do this? This was proven at the time, that was proven at the time, this has been proven since, what have you got to say about it? You look at the comparison between America and in Ireland, where we had a handful of doctors who actually had a spine and a backbone and stood up for their patients and further afield, were trying to warn more than just their own patients about this. And they're the ones that are being hauled up in front of the Irish Medical Council, and they're the ones that are getting publicly ridiculed over standing up and doing the right thing. I was angry.
But nothing in the Irish
angry.
media.
Sorry?
Nothing in the Irish media about Fauci.
Very little, but it has been true. A lot of people are talking about it. A lot of people.
But the mainstream. I mean, the Irish Times and RTE, and not only did he plead, his pleading has led to he's going to be indicted, which is a criminal offence. He's going to be indicted for contempt, and he'll face a criminal charge of the contempt of Congress. And although he may, I think the maximum is $1,000 fine and plus or minus a month in prison, and he won't get a month in prison because he's so old. But he'll be fined, and he'll have a criminal charge for being in contempt of Congress. And he's in contempt because he wouldn't answer basic medical questions. He wouldn't even answer what colour his tie was and the colour of the carpet. So, but the fact that he's going to be charged, that wasn't in the Irish media.
No.
But we gave him a medal.
We need to highlight it, but it's still the hypocrisy, though, Dr. Ralph. It's not even that of what he gets, because if he walked out of there, I wouldn't care. It's the fact he's being hauled in. Where is Luke O'Neill? Where is Stephen Donnelly? Where are all the decision makers from Ireland who forced all this on people and took livelihoods away and closed businesses down and stopped our children going to school and let older, vulnerable people die in nursing homes on their own? Where are they? Why aren't they being called up? Why are they calling up the people who were calling this out at the time? It does not make sense. We're not seeing what.
Yeah, I think
we don't do accountability.
No,
I mean, there's one thing about previous British governments, and especially the kind of conservative governments, where somebody would honourably fall on their sword if they were caught with a 19-year-old down in Soho or something. But people don't. They don't fall on swords anymore. They hold these little tiny mini daggers, and they go. Ooh, ooh, ooh.
No,
I've done my best.
I think you're way out of the line. No, I think you're way off the mark. Way off the mark. I think.
Well, tell us then. Put me back on the mark.
We're coming from you're right, but we're coming from a position where right and wrong and morality actually exists. And that's the kind of, so we're scratching our heads going, this is wrong. And how come it's wrong? But the truth of it is that the kind of the dichotomy or the discussion between what's right and wrong, that's something that the plebs, that people like us can do, and it's a little thing that we can entertain ourselves with. But the real notion of kind of what's right and wrong, we don't get to decide that. We get to talk about it, maybe, and we get to see a little bit of irony in Fauci and everything. But
we get to know it as well, Marcus.
No. But I think when you look at
we know it in there. That's all that matters. We know it in there.
Maybe we do on an individual basis. You're right. But the Fauci issue is what it highlights for me is that yes, here you've got this guy Fauci, and he's up in front of this Senate committee, and he's pleading the fifth. Now he's obviously been advised to plead the fifth. So he hasn't just decided himself, because it's not Fauci that's on trial. It's the manufacturers of the vaccine, and it's the people who have the multi-billion dollar investment here. That's who's on trial. Fauci is the face. So he's been instructed to react. And what he's been told to say is, say nothing, plead the fifth, plead the fifth. So we've got this little show going on of Fauci, and that's kind of entertaining, and maybe a little bit of justice for people like me and people like Billy and yourself who were awake through what was going on. But in reality, behind the scenes, these vaccines are still on the market. And they're not going to be pulled from the market, and they won't be pulled from the market. Yep. And until the Rubicon is crossed, until the public actually realize that these vaccines are actually harmful and dangerous and carcinogenic and seriously problematic for populations, and there has been excess mortality and deaths and people dying, until the vaccines are actually pulled and that truth is acknowledged, then everything else is a little bit of a sideshow. It's a bit of entertainment. So yes, Fauci will plead the fifth, but in the vast majority of people's minds, well, nobody has actually pulled these vaccines. They haven't been pulled from the shelf. So most people still believe that they're safe and that everything was okay, and maybe Fauci made a little bit of a mistake. And all of like somebody like RFK, for example, he knows absolutely that this technology and this type of vaccine is fundamentally wrong on a biological, on a human level, and even wrong on an environmental level, because we're tampering about with genetics. We're tampering about with people's genes. This is a genetic product. So he knows. And Trump is not a foolish man. Trump took hydroxychloroquine at the outset. Trump knows that there's something very, very strange with these vaccines, that they shouldn't be on the market. But it shows you actually Trump is powerless. RFK is powerless. The Irish government is powerless. So if all of the institutions of government, state, the institutions that entertain us, that we kind of speak to, are absolutely powerless to actually change anything, then we have to ask, is there something deeper going on here? Is there a deeper conversation going on here? Are people in control of the political establishment? And that's the harsh reality that was exposed in COVID, that public health and medicine is not in the control of the doctors. It's not in the control of the minister. It's not in the control. It's in control of, as Billy said at the outset, of financial corporations, of pharmaceutical industries, of Pfizer. And how that control is affected, that's a different question. One can ask, is Simon Harris just a complete idiot? Or is Simon Harris, is he duplicitous? Does he put on a face for the public and then he has meetings with the pharmaceutical companies or whatever and he talks to them? Does he actually know what he's doing? Do politicians, are they aware of their corruption? Or is it something they do subconsciously and they're not aware of it? But regardless, certainly what's going on with Fauci, that will peter along. But the real reality is that even the president of the United States, he might be able to go in and attack Iran. He might be able to drop bombs and do what he wants in that respect. But certainly, in terms of the pharmaceutical and corporations, he's utterly powerless, just like Micheál Martin is utterly powerless, because once they say we're going to pull jobs, or we're going to reduce employment, or you're going to affect our incomes. Well, that immediately has a knock-on effect for political careers, and a massive knock-on effect. So pharmaceutical companies that have the politicians completely in line, and Fauci is pleading the fifth, and it's all very funny, but behind the scenes, there's a deeper reality that people are only allowed cop onto when they've had a side effect, or they've had a vaccine that they don't need, or they've had a drug. I mean, there's definitely, when you look at the childhood immunization schedule, which I've never criticized, and I give all kids vaccines and have done all my life, but as they were being rolled out to us over the years, like things like rotavirus and diarrhea virus, and, slowly, there's a good 6, 7, maybe 8 vaccines there on the childhood immunization schedule that I would say seriously need to be looked at. Are we actually giving these because the children need them, or are we giving them because of a pharmaceutical agenda? And as Billy said, for example, with statins and with so many other drugs there, we're not giving them because people need them and because they're warranted. We're giving them because of a pharmaceutical agenda. So what's actually needed in Ireland is the same type of language of draining the swamp, but there has to be a full investigation into the vaccines that are given to children, the medications and the guidelines the doctors are operating by. All of this has to be looked at again. But I mean, I don't know if anyone has the power when physicians are so bribed into the system. And when people like Billy and I look over our shoulders and see so few physicians even willing to protect our right to discuss or to question drugs, it does appear to be quite hopeless, really. Sorry to be ending on a downer, but
I think it's going to take a power shift, in my opinion, and that's. I believe there's an undercurrent. I think COVID. I think they pushed too hard, too fast with people. And I think the pharmaceutical industry themselves have done a serious amount of damage to themselves. I do think there's a lot of people left injured from the vaccines. We see the sudden deaths, and particularly among younger people, it's gone through the roof. It's an uncomfortable truth. It's still very raw because it's still very fresh in our history. It's only a couple of years old. But I think, Dr. Ralph, you made a very valid point earlier on, as have you, Dr. De Brun, in relation to the words in my head. I think we have changed from healthcare to Medicare, because we've gone from looking after and talking to people about their health to talking to people about what medicine they need. And once you switch from one to the other, that's when people become dependent upon medicine. And once you start into that cycle of statins lead to stomach trouble, leads to liver failure, leads to, I don't know, I'm not a doctor, I'm just throwing terminology out there because I know people who are on statins who now have problems with their liver, who then have stomach trouble, and it all goes on to a cycle where you're dependent on medicine for the rest of your life.
But it's a much bigger picture. Even it's not just the medical profession. The medical profession is just one arm of. If people don't wake up, they're going to find that when they do wake up, they're going to be stuck in a digital cage. And there's no getting out of it. So we talked about people being coerced into the vaccine, and we talked about the profits of large pharmaceutical companies as that was a driver for the vaccine. But the digital ID that went along with it, called the COVID pass, had nothing to do with a COVID vaccine. It had to do with the beginning of the digitalization of your population. And we're going to see now where we're going to protect teenagers online by getting everybody else to register digitally online so we can keep an eye on what you're doing. And if you think there's no link between these laws to protect teenagers from the digital world, digital COVID passes, and these massive data centers and companies like Palantir in California who keep an eye on absolutely everything and squeal to any government who wants to pay them a fee as to who are the bad people and who are the good people. And if you're a really bad person and you happen to be living in the wrong environment, you get a hellfire missile through your window, and that's the end of you. That's one less bad person in that world. So that's all part of this digital cage that they're creating. So yes, we can talk about statins. Yes, we can talk about the power of pharmaceuticals, but they're all various tentacles without kind of generating this massive conspiracy theory. Democracies are a mess. People would much rather, or governments would rather say, Oh, let's be honest. We don't need a democracy. We need strong dictatorship because we want to be able to say to you, "This is how things work," and we don't want to have to ask you, "Can we do it?" We want to say, "Well, we'll ask you, but if you put up a resistance and we put you in your digital cage, we'll just close the walls down of your cage and give you a little squeeze to remind you who's in power." And so you're going to have populations living in squeezable digital cages. So they're going to be compliant. And you're not going to have the banks because the banks are messy. The banks create all these financial ups and downs because they do stupid things like they give money for buying houses and acquiring consumer goods. When in fact, most economists know if you want to prevent the boom bust cycle, you don't do all that crap. You just lend for business growth. And then people get their money and then they buy stuff with it. They don't do going out on credit. Then you don't have boom bust cycles. But if you want to get rid of all of that, you just get rid of the banks. And you have the central banks, your digital cage linked to the central banks, linked to social control, linked to a very, very happy government. And that's going to be Western democracies for the next few decades. So
I agree.
Welcome to the modern world.
Yeah, I agree. And they would never have been able to convince 93% of the population of Ireland. They would never have been able to convince all of those to go and get a QR code on their phone to say that they were compliant. It would never have happened. It was the first step. It was very successful from an Irish perspective, which is unfortunate, but it was. I do hope and think people have learned from it. A lot of people talk to me, and I know one of you mentioned that we need the pharmaceutical company to pull these products. An awful lot of people that I speak to, an awful lot of people said they will never, ever, ever get another vaccine again, ever. And they're people who got at least two vaccines, if not at least, and a booster. So there is a turn, but I know there's a bigger picture here, and this was step one, and they got the compliance, and they got the people to do what they do, and the snotty-nosed teenager was able to ask me my personal medical information in order for me to be able to sit indoors and have a sandwich with my children. So. So we are seeing.
I'm gonna have to wrap it up. So
okay, perfect. Yeah, we'll give it 5 more minutes just to.
Yeah.
See you, Billy. So Marcus, do you want to jump in there?
Yeah. Well, I mean, it's very, very difficult, I suppose, to be kind of constantly chipping away at what's happening to Ireland, and what's happening to medicine is really a microcosm of what's happening to Ireland, and it's bizarre the fact that we can't really talk about things, I mean, that's what Billy and I and the other doctors, that's what our cases are fundamentally about. You're not supposed to speak. You're not supposed to question drugs, which is weird. Because you're a doctor. Of course you're supposed to question drugs, and not only question them publicly, but question them with the patient and the individual who's taking them. So there's this kind of narrowing of human beings and narrowing of people in, I suppose, authority or anything, that everybody has to sing from a particular hymn sheet. And there's things that we can't talk about, and it's bizarre because, most people in Ireland, the most reasonably sensible people in Ireland are perfectly awake to the fact that there's a huge crisis in Ireland in terms of migrants, in terms of undocumented migrants coming into the country, coming across the non-existent border between Northern Ireland and the South, and you see this ridiculous kind of tension where the likes of Sinn Féin, who spent years trying to get rid of the border, now we have the reality of migrants coming in from the UK and simply walking across the border undocumented just because there's no security there. But because of this historical or whatever social pressure that you can't have a border, we have this ridiculous scenario where we're one of the only countries in Europe where that borders another country but doesn't actually have a border with that country. Yeah. So we've got these fundamentally ridiculous things going on in Ireland. Like, you can't talk about, undocumented migrants coming into Ireland. And even for the sake of the undocumented migrant, there are several thousands and thousands of undocumented migrants coming into Ireland with no access, even from their point of view, with no access to services, no health reviews, no access to healthcare, no screening for diseases. So we've got this bizarre situation right in front of people's eyes where you have massive social problems. And when I say social problems, I mean, we all remember, anybody listening to your show, and I'm sure you remember, that child that was raped or in an IPAS center by a man, an undocumented or whatever, a migrant, who was given his court order to have been removed from the country 6 or 12 months previously, and then went on to rape someone at an IPAS center. Now,
allegedly. Before, do you know
allegedly.
what, Dr. De Brun, will you stay on and we let Dr. Ralph head off?
Yeah.
Before you do, Dr. Ralph, one quick question for you. The only way that we have a chance here of making change is for us to step forward and put ourselves forward for election. Would you consider putting yourself forward for election in the future?
I'd rather chop off one of my own testicles.
His wife will kill him. Don't, Elaine. You'll His wife would execute him.
Thank you, Elaine. But no, I'm now about to saw off one of my testicles and cook it.
Oh my God.
I wouldn't eat it raw. Nobody eat a raw testicle.
His wife was going to kill him if he said yes to that.
Okay, on that note, I'll let you head off, Dr. Ralph. Thanks for that last finishing word. And enjoy your week. Okay. I'm sorry for interrupting you, Dr. De Brun. I just didn't want. I knew Dr. Ralph had to run off. So yeah, if you would like to continue on, you were making some very.
No, I was just saying. I mean, we're talking about visible things in medicine, like doctors not being able to talk and people having to take vaccines when they don't need them, and all of this, and freedom of speech gone out the window. Like, what the point that I'm making is if you just pare it back to kind of basic accountability in politics. I mean, O'Callaghan is the Minister for Justice. When that horrific thing happened to that child and the people on the streets came out and they were very, very angry in the area, regardless of course, we don't know the details of the case, but the man responsible or allegedly responsible or being accused was supposed to have been deported or gone from the country 6 months or longer prior to that. Now, the man responsible for that failure in that process, it was Minister O'Callaghan, whose sister, Miriam O'Callaghan, is in RTE. But where was the accountability in that process? Now, me as a doctor, if I step out of line, if I don't shake hands with somebody or don't use hand sanitizer at a public gathering, I face 5 years of medical council investigations. But there's a minister responsible for protecting the Irish people, protecting the state against this type of crime, who clearly is his department clearly failed, absolutely failed, and the man didn't even have to answer. Not even a single question about it. There's no inquiry, there's no questions, there's no nothing. So it's very difficult not to be very cynical. As you say, and you're right, we do need a massive political change, but the political change would have to be massive. It has to be an upheaval.
It does.
It does. Like Simon Harris.
When you consider, Luke O'Neill considered running for the presidency.
Oh, I think
he saw the backlash he was going to get, so he pulled out. It's like
I think it was Tony Holohan you're referring to. I think it was Tony Holohan. I don't know if O'Neill did as well. It was Tony Holohan.
It was Tony Holohan.
It was
exactly.
Tony Holohan.
Yeah.
But isn't that the way Irish politics works? I mean, Bertie Ahern kind of bankrupted the country, and he was going to run for the presidency too. Like, there is something inherently stupid in the Irish voter. I'm sorry, but that's I'm an Irish voter. There is something inherently stupid that we can. I mean, I can't even turn on the television. I don't watch the television, but if the likes of Simon Harris or Micheál Martin are on the television and they start talking, I have to leave the room because these people themselves are so fundamentally duplicitous. Absolutely, like Simon Harris, I think a terrible politician, an absolute terrible politician. And I don't know if he's not, and if it's unfair to say, or maybe I might get sued for saying, I think he's a terrible individual. I don't think that there's any real honesty or integrity there. But as an Irish person, stepping back and looking what's happening not only to my profession, to medicine, to the relationship between doctors and patients, which is fundamentally corrupted now by pharmaceutical companies and by so-called guidelines and by political agendas and by money. It's definitely very, very corrupted. When I look at my profession, that's one thing. And then when I look at the landscape of my country, and you think that the founding father of Ireland was Pádraig Pearse, and he lived in a cottage in was it Rossmuck, or he had his cottage in Rossmuck, and he valued the language, and he had his school, St. Enda's, where he was trying to reinvent the education system to include a different model to the British colonial one that had been here. When I look at how far Ireland has come from that ideology that the state was founded on, when you look at how far it's come, and the people who are prodding it in that direction, it's very, very difficult not to feel like, as you say, that there has to be a massive political upheaval before there's going to be any change. But how's that going to happen in a country where the likes of, when you have a presidency, it's totally the presidential election was a complete farce.
Oh, complete.
The political establishment is a complete farce. The likes of Micheál Martin and Simon Harris and the rest of them, so many of them are fundamentally either corrupt or entirely duplicitous. And, numerous people have classed Ireland as a government that's actually at war with its own people. And I'm utterly convinced of that. The process through the medical council, what it did to Billy and what it did to me and what it's done to 7 or 8 other doctors, we should have been going to the medical council and people should have been saying, well, thanks very much. You stimulated some debate and maybe, we're looking into these things now. But there's none of that. It's actually
they were on a witch hunt. They want to make sure that if there's ever a pandemic declared again, that there will be no doctor speaking out by making a bit of an example out of you. They can't make much of an example out of you, in fairness, because shaking hands with somebody without sanitizer and a few tweets is hardly criminal. But
they're not interested in that. They're not. They're just interested in finding you guilty.
They want to isolate you, give you as much exposure in the media as possible, so that it'll silence any future dissent or any future speaking out. Some just another point, because I'm conscious of the time as well. There was a case in the media recently. A girl called Jessica Sheedy, an 18-year-old, back in 2018. She was operated on by a surgeon in University of Limerick. His name was Dr. Ashish Yule, and he was a breast surgeon, and he performed surgery on this young woman to remove a benign tumour. He hit a main artery, and she lost 7 litres of blood. He failed, and he was convicted, or not convicted, but it was for 13 different cases against him in relation to his medical profession, and he admitted them. So because it said he was a breast surgeon, he should have called a vascular surgeon. He didn't. A nurse that was in the theatre at the time, she called a vascular surgeon, and 3 days later the lady died. But the frustrating thing again about this is this happened in 2018, and the family are very frustrated because it only went to the Irish Medical Council. The hearing was in January of this year, 2026. So it took 8 years to get this particular case to the Irish Medical Council, and all during that time he was paid an administration fee. There is no amount of money, I don't know how much that was, but he was being paid during that time. And during that time, he spent a 9-month period in New Zealand in 2021, 2023 and 2024, where he performed surgery on somebody and seemingly damaged their bile duct. Again, he wasn't competent or experienced to carry out this surgery. But he was getting paid by the Irish state during that time while he was under investigation. And yet he was able to travel to New Zealand and perform surgery. And there is another case against him, but I don't have the details of it. And his family are rightly upset and annoyed over how long it's taken for this hearing to be heard. And I spoke to you briefly about this beforehand. And what was your answer to me in relation to why it has taken so long for this doctor, who clearly killed a patient, why it took so long?
Well, over the past 5 years, the 8, 7, 8, 9, there's 9 of us in total, but the number of doctors who have been processed through the medical council over the past 4 or 5 years for objecting to COVID policies, that has certainly been a massive preoccupation for the council, because the medical council, the rights of a doctor are very, very, very much protected in Ireland and in most countries, in terms of medical council has to go through procedures. Now, the procedures are just kind of perfunctory and they go through them. They might have their notions about whether you're guilty or not, or what they want to do or use those proceedings. But the processes are very laborious in that to move from step one, from an investigation, for example, to a hearing or that sort of thing, there has to be a full meeting of the council and they all have to sit and agree, and then the barristers have to be informed. So the process of having 8 doctors going through these medical council hearings, and Jerry Waters in 2022 was actually suspended and his case went to the High Court, so all of that has certainly consumed a huge amount of time and a huge amount of resource. I mean, I couldn't guess at the amount of money that was involved in trying to suppress the doctors who were speaking out during COVID, but undoubtedly we're talking several million. And the amount of time, man hours of counsel and barrister time and legal time involved in suppressing the doctors and dealing with our cases and prosecuting us has taken an inordinate amount of time. So council only sits, I mean, these are volunteers. When I was on the council, well, volunteers are you're elected or appointed by the minister. So, everybody else has got a day job. Everyone on the council has got a day job. They do other things, so getting the council together to have meetings is a difficult thing to do because you've got to try and organise a quorum, which is a minimum of 12 or 14 members there, in order to progress any little matter that's before council. So there'd be no doubt in my mind that certainly this case was held up. And many cases are held up because of the political agenda, because certainly what happened to us and what we're going through is an entirely political issue. I mean, when you think of that somebody died and the medical council puts that to one side and is prosecuting a doctor about hand sanitizer or tweets, it really shows you kind of what's going on. But, there's a bigger picture outside of that case that most people aren't aware of. And I spoke to you a little bit about that before we came on, that people think institutions like medicine and institutions like government are there for their benefit. And for the most part, they are. But primarily they're there for their own benefit and to protect themselves. And looking after people is a secondary thing. And if it happens, well and good, but it's the self-promotion or self-preservation that is the primary function of most institutions in Ireland who present themselves as public institutions. They're not there for the public. They're there for themselves, and they're there for the institution themselves. And the medical council and medicine is no different. Most people think that the medical council is there to protect them. So, for example, if you go into a hospital and you're getting an operation, you're going to presume that the specialist doing the operation is a qualified specialist. You're going to presume that. You're going to believe that in your heart to be true. But that's not true. And you don't really matter. What matters is the money and the hospital, because how it works is completely different. How it works in Ireland is you've got 2 registers. You've got a specialist register, which people like me, qualified GPs who do a GP training scheme for 5 years, hospital rotations and examinations. And then we get a qualification from the College of General Practitioners, or to say that I'm a GP, for example. That makes me a specialist. So I go on to the specialist register. But in Ireland, there's 2 registers. There's a specialist and so you would think if Elaine's going in to get her appendix out in the hospital, that she's going to get her appendix out by a specialist who's on the specialist register. Correct. That's what you'd assume. But that's not the case. In Ireland, we've 2 registers. You've got a general register and then you've got a specialist register. Now, the general register was established when kind of medicine established maybe about 50, 60, 70 years ago, a long, long time ago, for when a doctor qualified, years and years ago, in the olden days, in the dark ages, when you qualified and you finished medical school and you did your internship, and you were finished your internship, you became a doctor. You got your license and you're a doctor. Then you went on to what they called the general register. Well, years later, as people started to make mistakes and mistakes started to happen, the regulatory body like the Medical Council was established, and we had this special register for specialists. So when you're a specialist, you go on the specialist register. And so in theory, hospitals are supposed to go to this specialist register and hire people from it. But in practice in Ireland, what they did was they kept the two registers. So you've got a general register and a specialist register. And the reason the general register, and any doctor from any European country, from abroad, from India, from anywhere at all, can come over to Ireland and register. Once they've done their internship, they can register on the general register. Well, the rules as they exist in Ireland is that any hospital in the country hiring doesn't have to hire from the specialist register. They can hire from the general register, which basically means that if the consultant in the hospital is going on holidays, or if the hospital is in Sligo or Donegal or West Cork or Aiton Kerry or somewhere, and they can't find a specialist, well, they can pick someone from the general register who isn't actually fully qualified to do what they do, might have a bit of experience, might have been doing it for a while, but isn't a qualified specialist. But the hospitals can pick that person because it's so hard to find specialists to fill in those jobs and do those jobs. So we have a situation in Ireland, and I've seen it on the Medical Council many, many times, where people, Professor, my question in that case that you asked, the very first question I would ask is this guy qualified? Was he fully qualified? Because as it exists in Ireland, you don't have to be fully qualified to be a surgeon. You don't, like, as a GP, for example, I work in the out-of-hours service. So, but the out-of-hours service struggles at times, at the weekends or in the evenings, to get qualified GPs like myself. So they can go to the general register and get a doctor who might come from Spain or might come from a different European country, who's not a GP, but who will work in the out of hours and fill in those gaps. And oftentimes in the Medical Council, the complaints that you see over and over again is mistakes that are made by someone who's working in a GP service but isn't a GP, somebody who's a surgeon but isn't actually a fully...
Is the patient not entitled to know that information?
Well, the patient is entitled to know, but if they would have to ask. Most patients, like you, when you're going in to get your appendix out, you completely assume that the surgeon is on the specialist register.
Before, that he wasn't a breast surgeon and he's just going to give an go on me.
Exactly. And so when you tell me about this case, as having been on the Medical Council, my first question is that person actually qualified? Because we have a system in Ireland. So, and you have to ask, why does this terrible system exist? Who is it facilitating? It's not facilitating patients. It's not protecting patients. It's facilitating government, hospitals, HSE, and ironically, it's the Medical Council's own system. So the Medical Council is over a system that creates its own work for itself. By the Medical Council having two registers, then when it has one register for unqualified doctors, so cases that appear before, and when I was on them, this was a major difficulty I had with the Medical Council, because my point, and some of the other doctors who've been on the Medical Council before, our point would be, why is it that when somebody goes to see a GP in a GP out of our service, the doctor's not a GP? Or when somebody's going to get an operation done, that the surgeon may not be a fully qualified surgeon? Why is that? And the answer is simple. The institution is there not to protect people. It has no interest in the people. It's there to protect itself. So it's there to facilitate hospitals, HSE, and cheapness too. Because it's very cheap. It's very cheap to hire a doctor who's not qualified. It's much cheaper to get a doctor off the general register than it is to get a specialist. So it takes the pressure off. It takes
Well,
but unfortunately,
it's
it
one to work.
causes a
It's
lot
one
of.
to look out for. It's one to look out for going forward. I tell you, and like
Yeah.
you say, I would just assume if you were put into a hospital and you're getting an operation, whatever operation you're getting, that the person that's operating on you knows what they're doing, and they've done it before. But that's not.
Well,
That's
they
not.
may know what they may know what they're doing. And in fairness, the hospitals are not completely blind. They will take a doctor from the general register, and perhaps that doctor has been a surgeon for 10 years, has been worked in various different countries around the world. But are they qualified specialists, or do
Mm,
they just have experience in their
mm,
field? They may have a degree of experience in their field, but they may not have the
no,
qualification.
it's
And
yeah,
that's those qualifications exist in order to protect the public.
of
People come to
course.
me because they know I'm a qualified doctor. If people came to me and later found out that I wasn't qualified and I'd been giving them advice, they'd feel a little bit hard done by. But
Mm,
that's, Elaine, that's the system. That's the system of Irish medicine. Not Irish medicine per se, but Irish regulation. So
in
when you hear
general,
that, when
yeah.
we say, yeah, so when the medical council is coming after people like me for not using a hand sanitizer during COVID, I think most people out there are aware that there's something else going on.
Yeah,
But
I
as you
think they
say,
do.
there has to be a big change. There has to be a big
Yeah.
political change. And
Which
when are
which
we going
leads
to
me
see that?
which leads me to my last question. We've gone over the hour, so the same as I asked Dr. Ralph. Is it something that you would consider in the future running for politics?
Oh, to be honest, I don't know. Elaine. I joined AIM2 because I really like Padder Tobin. I think he does his best, and I do think we all have an obligation to be involved in politics. But, if I ever was, it would have to be with the backing of the other people there or the party. And to be honest with you, I'd really have to feel that there was some kind of an appetite for change because, as I said, the corruption in Irish medicine and the corruption in Irish politics is so deep and ingrained. And the actual consequences of it now are so obvious in our society. And to be honest, I do feel that there is definitely a groundswell. There's a total difference because most people you talk to have a completely different view to what the shite that you have to listen to on RTE.
Yeah.
So there's definitely a shift. But I think if it got a lot stronger and if I felt that something good could come of it, I'd certainly consider it. But this has been a difficult time. It's been difficult for Billy, difficult for me and our families, difficult for anyone who's kind of stood up and said anything that's against the system. It's very, very powerful. But if I saw or thought for a moment that it could achieve some good, I'd certainly consider it. But I don't know.
Well,
I'm a bit
I think
cynical about the whole thing.
I think there's a big change on. I saw Michael McNamara, the MEP, came out during the week with a statement about what was going on with the Irish Medical Council and calling it a ludicrous show trials. That's what he referred to them as. And there was another Sinn Féin TD came out in support of Dr. Ralph. And saying again that whether you agree or don't agree with what you were saying, you have a right to say it, and I think a lot more people are realising that. But and I hope you do run for politics. I think you would make a fantastic TD in the future, and more of us need to put ourselves forward. I know I've done it already,
Well, we
but we
do.
need to be
And it's
we
not
need to
about
be we
just
need to be
about
circling the wagons.
Yeah, yeah. And it's not just about putting yourself forward. I mean, this is politics, what you're doing and what we're talking about, and trying to galvanize the people who are out there and realize how so fundamentally corrupt both medicine, politics, how our society has been so turned upside down, trying to get those people, up off their backsides and actually do something. That's the real hard work of politics. So that's
It
what you're
is.
doing
It
with
is.
the podcast. So hopefully we will see some change. But you are right. There definitely is a feeling.
We have
Yeah,
to keep hope, and
absolutely.
you and Dr. Ralph and there's more. If I name 5 of them today, I'll get in trouble. But you're on this podcast with me. You were 2 of the doctors, 2 of about 10 who spoke out at the time and who ultimately paid the price. And I've been very vocal all the time about all of you. That
You have been very
you
supportive and very, yeah, absolutely.
we're
Only
very
thank you.
proud of you, and we probably
Yeah.
don't tell you that enough, but we are, of
No,
everything
you
that you've
do. You do.
done. and of what what you're continuing to do. And we'll have more of these into the future, I'm sure, Dr. De Brun. But for today, thanks very much for joining me, and we'll get this out to as many people as possible. There's a lot of interesting information in here that people would love to hear. So thank you so much, and I'll chat to you again soon.
Always a pleasure, Elaine. Thank you very much.